Hello and welcome to this daily coronavirus update. We're bringing you live every weekday from Fox. I'm Gasia, Mikaelian. We'll be live streaming every weekday for you starting at 1 p.m. Eastern, 10 a.m. Pacific with the latest information about the coronavirus outbreak nationwide and globally. Our goal is to help you understand what's happening in your community and also give you a nationwide and global outlook on the effects of the coronavirus. We'll also, of course, give you the latest information on how to protect yourself as we all head into the weekend. So let's start with the numbers. And Fox has been tracking the numbers and we're sharing with you the latest. Worldwide, there are at least 97,994 confirmed cases of the coronavirus. Specifically in China, where it's believed to have originated, China is reporting 80,710 cases. Here in the United States, there are 233. Important to note quickly here before we move on, China just saw the slightest of all increases from yesterday's numbers into today. So back here at home, the United States is officially one of the top 10 countries with the most cases of coronavirus worldwide. Indiana just announced its first confirmed case in that state. Now let's talk about notable jumps, and we'll focus really on South Korea, which now has 6,284 cases. That's up about 500 cases from where we were yesterday at 5,766. Italy is now reporting 3,858 cases, and that's up from 3,089 cases yesterday. The United Kingdom is now reporting 118 cases, up about 30 from where we were yesterday. In France, 420 cases have been confirmed, and that's a jump from 282 cases yesterday. In Germany, there are 400 cases of coronavirus confirmed, and that's up by about 140 from where we were yesterday. In the Netherlands, there are 82 cases confirmed, a significant jump from what we saw yesterday, which was 38 cases. Back to the United States here, and the top 5 states that are reporting coronavirus cases. Washington State still at the top of this list with 70 cases confirmed there. Down the West Coast, we find California, which has 60 cases. 24 of them were repatriation, 36 non-repatriation cases. New York has 22 cases confirmed. Illinois has 5 cases confirmed. Tied for 5th with 3 cases each, Oregon, Florida, Texas, and Maryland. We do know that today, President Trump is going to be in Atlanta, and he'll be specifically visiting the Centers for Disease Control and Prevention. So let's go to Atlanta and bring in Beth Galvin with Fox 5. Beth, thanks for being with us. I understand the trip was on, then it was off, now it's back on. Tell us what happened.
Oh, good morning, Gasia. So the president, his planners had put a visit to the CDC on his agenda for today, for this afternoon, to kind of come by and check with the team that's working on the coronavirus here in Atlanta. And then his morning plans came out, and it was taken off the calendar for the day as he was going to Tennessee and then straight to Florida. So he was asked about that by reporters and said that they had kind of nixed the trip because someone here at the CDC, an employee, had, they thought, the coronavirus. Well, they in turn apparently have tested that employee, and the employee has tested negative. So now we're told that perhaps, although we're not certain, the president's trip is back on for this afternoon, coming here to the CDC after he visits Tennessee to take a look at some of the tornado hit areas there.
Beth, tell me about the test kits that the CDC promised to distribute to state and local health departments by the end of this week. Here we are, it's Friday. Has that happened?
So it has largely happened, according to the CDC. They now say more than 40 states and along with their local health departments have received the kits. And they say as of now, we should be able to run about 75,000 of these tests on people to see if they do indeed, in fact, have COVID-19.
What was the issue with the kits that we heard about at the beginning and midweek, and has that issue been resolved?
So we're about 8 weeks into this outbreak, and the CDC was very fast in getting together these diagnostic tests and getting them out to state and local health departments. Unfortunately, there was a faulty component with the tests, so that made the test results unreliable, and the states started to report back that they just weren't consistent with the test results. So they kind of had to go back to the drawing board, and they say what they have found a workaround where they're just sort of discounting that one component of the test, but it should not affect the reliability of the test. So we're back on track, but there's been a big lag. And so there's been what a lot of critics say, not enough testing, that we're sort of way behind other countries, Gasia.
How much activity is there around the president's visit today? Is it, normal business in Atlanta, or what's happening?
So I think it's, because it's been kind of tentative, we haven't seen a real gear up here. We do have all around me media crews here to cover it. And, we're being told that there's going to be a pretty big impact on our afternoon traffic, since he's set to arrive here later this afternoon after 3 o'clock. So I think that the CDC is eager to kind of show off what it's doing. There's a little bit of tension because the president has really been consistently downplaying the threat of this COVID-19, whereas the CDC has been holding, press conferences several times a week, really telling Americans that our lives will be disrupted and we will likely see more cases of community spread of the coronavirus. The president, though, very much sort of dampening down that message. So there is, Gasia, a little bit of friction between the scientists here at the CDC and the Trump administration on their messaging.
Beth, the fact that we've been focusing so heavily on the coronavirus means we've actually done very little coverage of the seasonal flu, which is usually what we talk about this time of year. Can you help us understand the risk factors and the danger of the coronavirus versus the seasonal flu?
So we're, as you know, right in the middle of flu season, getting hit by a pretty hard flu season. That's kind of confusing because the coronavirus symptoms are very similar to to flu symptoms. So COVID-19 symptoms tend to be a cough, a fever, and as it gets more advanced or you have complications, difficulty breathing, kind of a pneumonia-like illness. The flu can be very similar. With flu, you typically have body aches that hit you very hard and very quickly. You have cough, you have sore throat, and you have fever. So it can be a little bit confusing, and especially for emergency departments who can't do diagnostic testing when somebody comes in very rapidly, because there is no sort of point of contact test right now like we do with the flu, where you can do a little swab and pretty quickly get results and figure out what strain of the flu that you have. So there is a little bit of confusion. There's also some criticism with people saying the media is hyping this too much because, the real danger lies in seasonal flu. Well, what's different about COVID-19 is that this is a completely new virus that we've never seen before. So we don't have any immunity to it naturally like we do some of the flu viruses that we've been exposed to. We also don't have we don't have a vaccine for COVID-19, and we don't really have very easy diagnostic tests or approved treatments for it. There's also the issue of the case fatality rates, and that's the number of people who die, who get each one of these. With the flu, the case fatality rate is 0.1%. So 0.1% of people who get the flu will develop complications of it. With COVID, we don't really know what the case fatality rate is yet, but we're getting different numbers based on different countries, Gasia. So in countries like China that have been very hard hit, the case fatality rate is somewhere over 3%. In other countries, it's maybe hovering around 0.2%. Some people say it's going to be 2%, so we really don't know. But we do know that certain groups, just like with the flu, are going to be considered high risk with this, Gasia.
I know the seasonal flu tends to hit young children very hard, and here in the U.S., you're advised to have your children above the age of 6 months vaccinated. Interesting that the coronavirus appears to be affecting older people more than the younger ones.
Yes. So what they're saying right now is we're more likely to see complications based on what we've seen in other countries with people who are about 60 or older. So seniors, especially seniors who have an underlying health issue. This can also be a real issue for people who are undergoing cancer treatment or some sort of transplant patients whose immune systems might be suppressed, may have a hard time fighting off complications from this. With children, though, and this should be, pretty good news for parents, we're not seeing nearly the sort of rates of complication that we see with seasonal influenza with COVID-19. So if children are getting sick with this, their symptoms tend to be much milder than what we're seeing in adults. Some children may be contracting the virus but actually having no symptoms at all. Now that can be problematic if we start to have community spread here in the United States. Children may be carriers of this, although they're not symptomatic, and then they could be exposing, grandma or grandpa or older people in their lives to the virus without anyone knowing it. Gasia?
All right, Beth Galvin there in Atlanta. We're going to cut you loose because I know you're preparing for the president's visit. We'll likely bring you back during our coverage here. Beth Galvin in Atlanta, thank you for that. Let's talk about if you're nervous, or if more importantly, if you're feeling ill, should you reach out to your doctor? If so, when and how? Let's get you some answers by welcoming to our coverage Dr. Amy Parekh, Chief Medical Officer at Grand Rounds, a personal health care company based in San Francisco, California. Thank you for being with us. I hope we can get that microphone working. My first question, and I'll say it slow, a lot of people are feeling like they might have something going on. Either they're actually sick or they're thinking they may be sick. At what point should we take the step of reaching out and contacting our doctor?
Yeah, so the most important thing is that if you are starting to have symptoms or you're worried that you've been exposed to someone with COVID-19, it is important that you call your local healthcare provider. It is, though, important that you call first before you go in person, because if you were to go in person and did have the illness, even if you're a healthy person, you could be putting others at risk, namely people who are in those offices and are immunocompromised or are immunosuppressed or are in some of the higher risk populations. The other thing is this is a nice time for companies like ours that are virtual to provide services for people. So what we're finding is because we're available virtually for 5 million lives, people are calling us. And that's a nice way to help sort of overloaded primary care clinics and urgent care centers help manage and triage patients who are healthy and should stay at home with maybe mild symptoms and those that really do need in-person care.
I know at my pediatrician's office, Dr. Amy, there's a sign that says, please let the nurse know if you have a serious cough or a cold and if you need to be isolated, sort of putting the burden on the patient, if you will. Are doctors' offices reacting differently? Let's say I do call and say, hey, doc, I'm sneezing, I'm coughing, and I think I might have something serious. What then does that doctor's office do?
Yeah, so I think doctors' offices in real time and health systems are coming up with their protocols of how they're going to help manage patients. I've heard some private practices here in the local area and nationally are having a special call-in time and asking patients to call at that time. And then if patients are calling with symptoms, they've set up separate hours to be able to examine patients who in fact need in-person examination. For others, they're doing a majority of their triaging via the telephone. So asking very pointed questions, understanding what the symptoms are, asking patients to take their temperature and relay that over the phone so that they can help advise without having an in-person visit. And that's the kind of stuff we're doing for our members across the country as well right now. The third is for health systems. They are starting to do some proactive outreach to all of their lives that they serve, specifically telling people what they should be watching for, what's something not to worry about, and what people could be doing to prevent illness, and making sure that people know if they have a regularly scheduled appointment in that clinic to call ahead, especially if they're having any of those symptoms or if they've traveled to any of the high-risk countries.
Dr. Amy Parekh, thank you for joining us live from the Bay Area. I'll put a quick pause on you because we want to look with a worldwide perspective. We'll get back to what we can do in our own doctor's offices in a minute. Certainly most people are taking the coronavirus threat seriously. Certainly most countries you're seeing are reacting appropriately. However, the World Health Organization says that is not always the case. So I'd like to share with you now what one doctor with the WHO is outlining the agency's concerns about that.
We're concerned that some countries have either not taken this seriously enough or have decided there is nothing they can do. We're concerned that in some countries, the level of political commitment and the actions that demonstrate that commitment do not match the level of the threat we all face. This is not a drill. This is not the time to give up. This is not a time for excuses. This is a time for pulling out all the stops. Countries have been planning for scenarios like this for decades. Now is the time to act on those plans.
Hearing there from a doctor making it very clear that countries, governments, people should take this very seriously, certainly at least from my experience here in the United States, that is the case. In fact, we heard yesterday, and we brought it to you live in this daily live stream, Mayor of San Francisco, London Breed, in announcing the first 2 cases in San Francisco. She said, this is something we were expecting. This does not come as a surprise that it's made it to our city. So again, local governments are preparing, as is the federal government, and certainly that concern is being felt worldwide. Let's go now to Los Angeles, and let's focus on what's happening at UCLA, because there are some students there who are in self-quarantine due to coronavirus concerns. I'd like to bring in reporter Mario Ramirez from Los Angeles. I'll be honest, I remember my college days, and you know, a college situation is like a petri dish when it comes to contact with others. So I can't imagine how the students are doing this.
Yeah, Gasia, good morning. And there's no doubt there's a lot of close contact here at UCLA's Westwood campus, tens of thousands of students. And there was an email that was sent out to students early this morning, and it basically was letting them know that 3 UCLA students are currently being tested for COVID-19. The officials saying there's no known risk to students here on campus, but they did want to make sure that they're letting them know that this is happening. They say they are off-site, off-campus, self-quarantine right now. And that brought up a lot of questions that we just don't know right now about those 3 students. Did they travel to some of the impacted countries? Are they even showing signs or symptoms of the novel coronavirus? And we are waiting for those test results. But in the meantime, a lot of students here are talking about this. There are some preventative measures that UCLA is taking to deal with this. They have been working very closely with the LA County Public Health Department. Some of the things they're doing here on campus is adding some more hand sanitizing stations across campus. They're also using antiviral chemical solutions to clean some of the public surfaces here. And they're even considering online lectures and off-site testing options because of COVID-19. But we can also tell you that they're considering a meeting on Monday. That is health officials along with university UCLA officials to answer questions from students and faculty about coronavirus, because they know there are a lot of rumors. They know a lot of students are talking with each other, and they might not have all of the information. So as we wait for those test results, that's the buzz on campus today. And we talked to a lot of students about whether or not they feel that this is being overhyped. Do they feel that the university system is doing enough? And they feel that at this point, you can't be safe enough. And that's what we've been hearing throughout the week. Several local government agencies declaring states of emergencies. So it really is something that people are paying close attention to, a lot of the students here on campus at UCLA in Westwood. Gasia.
Mario, I imagine there are sports games, other social activities, the big things, if you will, in college life. Are those activities going on as planned or being canceled?
So UCLA's athletic department says that games will continue as scheduled, but they have done a few things. They have suspended meet and greets with their athletes because, as you know, that involves a lot of handshaking and close contact. And we've been talking about these social distancing practices, and that's a part of it here. So they have scaled back on some of those events. There's also the Nowruz Festival, a 12th annual festival that was scheduled this Sunday, and that was celebrating the Iranian New Year. That has since been canceled out of fears of coronavirus. And we can also tell you the marathon, the LA Marathon, passes through this area. That is still happening on Sunday, but the Public Health Department here in LA County has released guidelines for spectators to make sure that they are not spreading, or at least they're aware of everything they can be to prevent COVID-19. Washing your hands, of course, for at least 20 seconds as often as you can throughout the day, and some other preventative measures that they really want the public to know here.
I know that we've heard from public health officials that those of us who are not sick should not be wearing masks. I still see them all around town. Are you seeing a lot of that, either there at UCLA or just in Los Angeles in general?
You know, we have seen a few masks here on campus, but it's interesting because we've seen this play out in different ways throughout the week, throughout the last few weeks. Here on campus, a lot of the students we spoke to today, they understand that the mortality rate is around 2% for these cases that have become infected. So their demographic here, young people, you know, in their late teens, early 20s, they're not as concerned. They understand that most of the cases that have turned fatal or become more severe over 50, people, over that age. So the concern isn't as severe as we've seen at, let's say, LAX, one of the, world's nation's busiest airports. But we still have seen masks here, and people say better safe than sorry. And many of them know which ones to purchase, those N95 masks with the filters. So we are seeing that here on campus, but not as much as we would at airports or other public places like that.
Okay, certainly I'm assuming UCLA is a bit quieter today than it would be on a typical Friday. Mario Ramirez from Los Angeles, thank you for joining us as we have 3 students there at UCLA who are in self-quarantine, and there are some changes happening on campus as a result. A quick good morning or good afternoon to you, and a welcome to this live webcast we're doing every weekday for you. It's meant to focus on the newest information when it comes to the coronavirus, the number of cases here in the United States and globally. We're focusing on the areas of concern and also highlighting what you can do to help keep yourself safe. And we're also working to bust some myths. I mentioned a moment ago in the earlier weeks we saw a lot of people wearing those masks, and now doctors are getting the message out that if you're not sick, don't wear a mask. You don't need one. So thank you again for joining us on this webcast. We're going to bring it to you starting every weekday from 1 Eastern, 10 Pacific time for the next couple of hours. So we are definitely in it now. Let's talk a little bit about what's happening just off the coast of the California Bay Area. And for that, I'd like to bring in reporter Allie Rasmus from KTVU. You are live in San Francisco, Allie, and there is a cruise ship couple 100 miles off the coast where you are. You're actually in Richmond in front of a testing facility there.
Yes, and it's kind of a dramatic story, Gasia, how a 45 tests of COVID-19 taken from passengers on that cruise ship that's about 100 nautical miles off the coast of San Francisco. 45 passengers and crew members had to get tested for possible coronavirus. The way that they got those tests to those patients and then transported it here to the state lab was pretty dramatic. In fact, there's some video that we've been showing of a California Air National Guard crew that actually rappelled and dropped off those test kits on the deck of that cruise ship, and the people were tested, and then they transported those tests back up by helicopter and transported them here to this California Department of Health run lab here in Richmond. Now, Richmond, as you know, about 15 miles northeast of San Francisco, and even a farther distance away from where that cruise ship is, just sitting in the bay right now. But this is the state lab here behind us, and we've been throughout the morning trying to get in touch with someone from the California Department of Health, California Office of Emergency Services to find out when those test results could come back. We were told that sometime today is when we would get some answers about when they could get the results of those tests taken from those 45 people on board that Grand Princess cruise ship. Altogether, 45 people tested for possible exposure to coronavirus. That's a small fraction of the more than 3,500 people who are on board that ship. Now, as for the people on that ship, they are stuck off the coast of California, 100 miles off of the San Francisco coast, stuck on that ship. That ship cannot come and berth at its home port here in San Francisco because of concerns about coronavirus. There's about 35 people on board who reported having flu-like symptoms during the course of that cruise. And earlier this week, a passenger who had been on an earlier leg of that cruise and had already disembarked, he died from coronavirus in Placer County here in Northern California. So that kind of raised the alarms about possible exposure to all the other passengers of coronavirus on that ship, and that's why it remains off the coast and not allowed to come into the port of San Francisco and dock here, and people on board aren't allowed to disembark. But in the meantime, we're waiting to find out what those test results show. Are there people on board that ship that could have coronavirus, COVID-19? That's what we've been desperately trying to get the information to find out all throughout the morning, contacting more than a dozen people with state health departments and the State Office of Emergency Services, and we have not heard back from any of them yet so far.
Allie, as you mentioned, it is a very small percentage of people who are on that cruise ship who are being tested for coronavirus. Let's talk about the vast majority of them. I've seen that some passengers are talking about their experience going on YouTube and other, social media apps, just kind of describing, here I am in my cabin, this is what we're being told. So it's interesting to get their viewpoint that way.
Yes, and they've been told that they've been saying that they're overall fairly comfortable given the circumstances. You know, Princess Cruise Lines has said that they've increased the Wi-Fi capacity on the ship so that people stuck on board can communicate with the outside world, and that's how they've been sharing their situation and their experiences, also communicating with their family and loved ones who are interested, obviously, to see what's going on in that ship. We've also learned that from some of the people on board that they're getting room service, plated meals. The buffet is no longer an option, so people are coming to their doors, their cabin doors, and delivering food to them to minimize potential exposure.
Yeah, certainly not the vacation they expected. I mean, anytime, look, I know you've been a reporter, for a long time, and it used to be the main concern when it came to cruise ships was the norovirus, and we've reported many times on how quickly that can spread and what kind of misery that can bring. But this is sort of a 2020 version of something people may not have expected on this cruise.
Yes, and reading some of the reports about the conditions on a cruise ship, the very nature of it, just kind of lends itself to contagion in these types of situations, because you have a lot of people in a confined space and a lot of contact from one person to the next, and unfortunately that's how these things spread.
All right, Ali Rasmus from KTVU Fox 2 in the San Francisco Bay Area. We will put you on pause as you're there in Richmond waiting for those test results. If she gets them, when she gets them, I know she'll bring them straight to us. So good work from Ali Rasmus. We mentioned a minute ago about the travel industry, and it's not just cruise ships that are being affected. Airlines, other industries directly tied to tourism being deeply, deeply affected by the coronavirus crisis. So we'll turn now to San Francisco reporter Brooks Jarose. He spoke with a travel journalist on the effects the coronavirus is having on the travel industry, and also what some travelers can do to take precaution against it. Let's listen.
I'm joined by Angel Castellanos, travel journalist based out of the Los Angeles area. Angel, thank you for joining us today.
Thank you for having me.
Sure
we have
thing.
Lots to talk about.
We sure do. I want to start with maybe one of the most basic questions, but I know a lot of people are just wondering, is it safe to travel right now, in your opinion, especially outside the United States?
I feel it is. I'm not canceling any sort of trips. The world is definitely a big place, but if you're relying on good information put out by the CDC and World Health Organization, you'll find that a lot of the cases that are reported are minimal, especially in places where travelers want to go.
We talk a lot about how this virus is spread and close contact with people. You think about being inside a plane when you're around other people. What sorts of precautions would you recommend people take?
Listen, I've flown every week this year. I've been out of the country since coronavirus broke, and it's been around, so I'm washing my hands just like everyone else, but I'm washing my hands a little bit more obsessively. I'm taking the hand sanitizer very, very seriously and wiping down my area of the plane. But when you get to your destination, you may want to consider your surrounding environment. If you're getting in and out of Ubers, if you're in public places, museums, wash your hands much more frequently. And then one of the filthiest things in the hotel room is the remote control. So I like to put my remote control in a Ziploc bag to avoid touching it.
I was just going to ask you, what are some of the things people should be packing in their go bag or have ready and accessible that maybe they haven't thought of as critically, but they should be thinking about now? Other than the bag, what are some other things you do?
Yeah, so I like to take vitamins and immune boosters. Doctors are recommending lots of zinc or even saline solution if you tend to have dry nostrils, because the air on the airplane is very, very dry. But lots of snacks really help in case you do get delayed for whatever reason. And if for whatever reason you get a quarantine happening, or if there is a delay, having that extra medication really does help. So if you carry prescription drugs, make sure you carry enough of them with you.
We just heard about another death from coronavirus up in Placer County here in California, and that kind of linking back to a cruise ship. Should people be afraid to go on a cruise ship right now?
Well, cruise ships deal with all sorts of issues as they relate to diseases and viruses. Actually, cruise ships are obsessive in their cleanliness when it comes to keeping travelers' health in check. So I wouldn't necessarily avoid cruise ships at the moment, especially because if you look at the Caribbean, where there's a huge cruise industry, there's no cases of coronavirus reported, except other than the Dominican Republic.
So would you recommend people, whether it's a cruise or something else, be looking at their travel plans and considering canceling plans?
You know, I wouldn't. I would consider monitoring the situation, because what happens if you cancel now, you'll just lose out on all of your money. You can't just cancel out of fear. Travel insurance companies won't honor that, and neither will tour providers. But what you can do is just really closely monitor that situation and sit tight, because, you know, once it starts to heat up throughout the world and once summer hits, this could easily blow over. And airlines now are offering the option to completely rebook without any sort of penalty or without any sort of cancellation fee. So that's good.
I know that there is a lot of fear out there, and we think about all these big vacation plans we may have, but we may forget about just traveling to and from work, going to the grocery store, doing our day-to-day business. What is your advice, though, about public transportation? Should people be avoiding public transportation? Should they take extra precautions? If so, what should they do?
I think, you know, for those who are taking public transportation, that's a whole different animal, because here in the United States, travel hasn't been restricted and travel isn't inhibited in any sort of way. So just like if you're traveling on a plane, you should definitely wash your hands and sanitize. An alcohol-based sanitizer really does make a difference. If you are considering whether to drive yourself or whether to take public transportation, you may just want to feel it out. You know, driving yourself in these cases, there's no shame in that.
You know, in the Bay Area, we have Uber, we have Lyft based here, and we have a lot of people who drive for those companies. Do you have any advice for those people who are carting around passengers from sometimes all over the world?
I think that they should definitely take the same precautions as I, as a traveler, take on an airplane. They should wipe their car down after every single passenger. And it takes some investing in some proper, you know, cleaning product that'll actually disinfect the vehicle. But I think that works both ways. It's going to make the passenger feel a whole lot safer, as well as the driver.
You know, we talk about the flu also causing many deaths across the U.S. And now with all these fears of coronavirus, I think, you know, washing your hands is much more top of mind than it was, say, a month ago. What are some of the other things you would advise people in terms of traveling? Should they be afraid to book things because of these new fears over coronavirus?
No, because, you know, we can't really predict the future, and travel is not for fearful people. But if you're taking your health really seriously, if you're hydrating when you're traveling, if you're getting plenty of rest, you don't want to do anything that's going to compromise your immune system by any stretch of the imagination. And it's the people who have immune systems who are compromised, definitely you don't want them to travel, and we advise that they don't travel either. If you do have the flu, you don't want to travel so you don't get your neighbor and fellow traveler sick, but you want to avoid quarantine. So if you're coughing and sneezing, it is better to stay home. But if you're just booking your travel for spring break and for summer, you know, you just want to avoid the destinations that the CDC has issued the highest level warning for. So you can't go to China at the moment, limited travel to South Korea. Definitely Iran is off the table. So the world is such a big place that you can travel all over if you really wanted to.
Angel, do you think the danger is greater when you travel outside U.S. borders, or is it just as dangerous to travel within the U.S.?
Well, we have very few reported cases here in this country, and we don't have travel restrictions in this country. So, you know, travel is supposed to be on the rise for spring break here in America, whether you're going to Florida, Arizona, or taking that classic road trip or going to national parks. You know, we have such an amazing country that I think it is okay to rethink your travels and think, well, maybe it is time to explore my own country here for just a little bit. As long as you're traveling and having fun and enjoying yourself, but more importantly, taking that precaution, you're going to be just fine.
All right, Angel, thanks so much for joining us today. We really appreciate your time.
Thanks for having me.
And as we were learning together about some precautions travelers should be taking, I got some breaking news from my producer Anna. She said that there are now 3 more cases of the coronavirus confirmed in California. So we've updated this list with the newest numbers. Washington state still has the most of any state at 70. California now has 63 confirmed cases of the coronavirus. I'm told those 3 newest cases are in the San Francisco Bay Area. Next, we have New York with 33 cases. Illinois has 5 and Florida has 4 cases. So again, the numbers are changing as we speak, and that is why we are here with you to bring you the latest information as we're getting it. All right, let's go back now to Dr. Amy Parekh. She is a doctor in the San Francisco Bay Area. Amy, you talked with us a minute ago about the importance of monitoring your own symptoms and really knowing when it's time to call your doctor instead of just rushing in. I think the thing that's concerning most people I talk with is the fact that many of these cases of coronavirus are from community spread. Yeah. People who did not go to a place where coronavirus is widespread, people who do not have direct contact with someone who is ill. It's that mystery that is so concerning.
Yeah, so community spread is kind of how we think about the flu, right? Which is when you get the flu, you don't necessarily know exactly who you got it from or how you got it. You just start to experience symptoms and have it. So coronavirus is starting to be spread through the community in California and other places in the country. And I don't think, just like Mayor Breed said yesterday, I don't think we're surprised by new diagnosis. I anticipate over the next hour, over the next 3 hours, we'll continue to see new cases. But what's most important is that patients who are young and healthy and are experiencing viral symptoms of cough, cold, and some shortness of breath, as your symptoms become more severe, it's important that you reach out to your local providers. But what's most important is if you're a high-risk person, namely someone who is over the age of 60 or has comorbidities, you really should be reaching out to your local health provider or virtual care if that's available to you to make sure that you're getting the right treatment at the right time.
I was reading up on what was happening where the coronavirus is said to have originated in China, and there was a lot of focus there on what researchers called family spread. I have 2 little boys.
Yeah.
They're in elementary school. What they bring home to me, it automatically goes to my husband, goes to me. And, we joke, we pass the same thing around, the 4 of us, for months and months. In a family, how can you present that close contact that just goes with being part of a family under one roof?
Yeah, so I'm a doctor, I'm also a mom. So I have young children as well who are in elementary school.
So you know?
Yeah, so I have empathy
Yes.
for all of our parents out there. Some of the things we've instituted in our own home that I can tell you about is making sure that when your children come home from school, they are washing their hands first and foremost. So especially on their way to school, I instruct my children to wash their hands before and after recess, before and after lunch. Most schools are incorporating more access to hand sanitizer as well right now. But then also when they're coming home from school, where they might now be interacting with higher risk individuals. So if you have grandparents in the home, for example, making sure that as soon as they come home from school, they're washing their hands, they're putting their backpacks in a separate place so that they can then go about their activities at home is key to prevention of spread within a family. The other is the one time where a clinician would recommend a mask is if you are in a home where one person does have signs and symptoms of the virus or any virus, even if it's the flu. If you are the person caring for that sick member, it might be worth making sure that member is wearing, that patient is wearing a mask so that you then don't contract the illness and pass it on to others in your family. One more step that most families should be taking in their minds as they prepare for perhaps one member of their family getting sick is making sure you know where in your home you would have the sicker person stay and sleep and who would be the primary caregiver for that person. So that, again, just trying to limit the spread within the family. Those are the main techniques I would recommend for a family right now.
So basically, if mom is sick, she shouldn't camp out on the living room couch. Go back in that spare bedroom if you're lucky enough to have one and get your care there. All right, Dr. Amy, thank you. We'll come back to you again in just a minute here. Let's shift our focus a little bit because as we've been talking about the number of ways coronavirus is impacting the local economy, the global economy, we haven't talked a lot about the effect on the entertainment industry. And while many people might think that's a luxury to be concerned about that, it does certainly employ millions of people, and there are concerns about the health of the entertainment industry and what major changes are happening because of the coronavirus. So for that, we bring in Fox 5's Kevin McCarthy in Washington, D.C. Thank you for being with us. Let's start with one of the biggest film festivals of all, and that's Cannes.
Yeah, this is a major deal. Obviously, we're talking about the entertainment industry. Specifically, I think the biggest story right now is really the James Bond story in regards to that film being pushed back from an April release date to a November release date, and the idea of what that means for global box office. I mean, really, when it comes down to it, I think this whole idea of shutting down certain theaters in certain markets, that really affects the box office. And you think about something like a James Bond, for example, that movie, like if you look at Skyfall. Skyfall was a very popular Bond film that made $1.1 billion at the worldwide box office. Over 800 million of that was international. And you think about these markets like China, Italy, and France, where films that are global films that do really well. And you talk about Cannes, obviously a big film festival happening in May. There are so many things to look at here, and what other films are going to follow suit, what other films are going to move as well. So the big question comes down to, if you release a movie domestically in the United States and you don't give it the China release or the international release, you're talking about losing millions and millions and millions of dollars. Now, I was reading today in the Hollywood Reporter that even the Bond move, even the moving No Time to Die from April to November, is still going to cost MGM, reportedly, according to the Hollywood Reporter article, between $30 and $50 million. Now, that's significantly less, from what I understand, than releasing the film and obviously not having the international markets like China. So, for example, if they were to release the film on April 10th, like they were normally going to, with around 70,000 theaters closed in China, that was definitely going to affect their box office. So it was a smart move to move it to November. But the question then becomes, why move it 7 months? And I think, in my opinion, I have a theory on that. I mean, you don't move it 7 months because you're worried about those 7 months being a time period where no one's going to go to the movies. You move it, in my opinion, because movie studios have relationships with IMAX. So, for example, the new James Bond film was shot with IMAX cameras, so they're actually going to release the film on IMAX screens, and you have to schedule that,
right,
a long time in advance. Other movie studios take those slots,
right. There are far fewer IMAX
year,
screens.
So they probably had to look ahead to November.
No, I'm sorry. I was just saying there are far fewer IMAX screens than there are your traditional movie screens. So you can't just, willy-nilly say, what the heck, I'll have it on that weekend. Let me ask you about
Exactly. I mean, you think about IMAX.
Oh, I'm sorry. We're having a hard time at this. Yeah, so let me ask you real quick, Kevin, about the personal movie-going experience. I'm sitting in a huge room with a lot of strangers for 2.5 hours. Are people still going to go to the movies if they're concerned about catching something from someone next to them?
I mean, I don't know the exact answer to that question. I mean, I know I'm still going to go to the movies. I still think that people should be able to travel, for their own personal reasons. I was listening to one of your guests earlier about the idea of not canceling things out of fear. I mean, in my opinion, the movie theater experience is one of the greatest experiences you can have in the entertainment element. And to me, that, movie theaters, yes, they are dirty. There's people, everyone's going in and out of them. There are foods everywhere. So I feel like, yes, I mean, I'm sure that's probably a concern. Will it affect the box office is the big question, right? So last weekend with The Invisible Man opening up, right during the coronavirus outbreak, obviously, that movie still made $29 to $30 million in its opening weekend. So people are still going to the movies. The question will be this weekend. Obviously, if things have gotten grown, and in my area specifically, I live in the D.C. area, so we had 3 cases in Montgomery County recently. So I'm wondering if that's going to affect any of the domestic box office this weekend for Pixar's Onward or Ben Affleck's movie The Way Back. But it's going to be an interesting thing, and you also got to look at streaming, right? What's going to happen with streaming? Netflix, Hulu, Disney Plus, Amazon Prime. Will those numbers skyrocket? Will less people go to the movies, like you mentioned, and stay home and watch those films? Then you look at something like Disney, right? Disney is a very interesting element because you have Mulan coming out on March 26th in the United States, March 27th in China. And as I mentioned, the Hollywood Reporter article mentioned that around 70,000 theaters are closed in China. What do you do if you're Disney? Do you still roll out Mulan as a global release? Some people have been talking about the idea, what if Mulan was put on Disney Plus? So you think about other options, but then you lose to piracy and things like that. But if you put out Mulan in the United States and you don't give it to China, the piracy, that's the other thing. People are just going to pirate the film. So I don't really know what Mulan, what's going to happen with Mulan or other global rollouts like Fast and Furious or films like Trolls World Tour. There's so many different elements to look at here in regards to timing and scheduling. But we know this now, that the movie business is an international business, more so than it's ever been before. They are making films specifically for international audiences because movies do better internationally than they do domestically. I mean, Avengers Endgame made $2.7 billion worldwide at the box office. 1.8 of that was international, including partly China as well. So that's what you have to look at here, is the global effect a movie will have if it's released during a time period where theaters are closed.
So, Kevin, talk to the cynics now, the people who say, when it comes to the coronavirus, we should be focusing on people's health, we should be focusing on people's safety. To think about something like the entertainment industry, right, they might see it as trivial. Talk us out of that concern and explain why we really are focusing on Hollywood.
I mean, listen, at the end of the day, the human element is the most important, right? That is the most important thing, is the human element, our safety and our health. But you also have to look at it from a business standpoint. The entertainment industry is a business industry, we know that, and you're talking about losing potentially billions of dollars. There was an article in the Hollywood Reporter, I believe last week, that said the entertainment industry and the film industry could lose $5 billion over this. Now, those are, speculative numbers, but that is going to affect people's jobs, I mean, the idea of movies, it's not just the box office. I mean, there are so many people making films, marketing films, running movie theaters. So I think, while it may seem trivial to say, oh, the movies are going to be affected, you got to think about the jobs that are also affected by that aspect as well. And so that becomes a human element. It really does. Even though movies are entertainment, there's still human beings behind it all.
All right, Kevin McCarthy, live for us. No, I get it, man. That's that's people's jobs, people's livelihoods could have a dramatic impact. Kevin McCarthy, live there at a Fox 5 in Washington, D.C. Thank you so much for joining us. All right, let's.
No, thank you so much for having me.
No, of course. We'll talk to him again, I'm sure. Let's focus now on what's happening throughout the coronavirus when it comes to the local picture, the national picture, and the global picture. If you're just joining us here, we are coming up on a pretty important number here to share with you from stock. So we're glad that you're with us, as every weekday we're going to be bringing you continuous coronavirus coverage as we bring you this live webcast on your station's Facebook page or the station's page itself. The Dow Jones is down more than 550 points, losing more than 2%, but this is not that bad compared to where we were when the bell rang to kick off this Friday's session. Now, stocks have been volatile for the past 2 weeks due to coronavirus concerns. The Dow Jones has been down by 1,000 points or more on a number of days in the past 2 weeks. So at this point, when you see that it's down by just more than 2%, you could think to yourself, this is no good, but at least we are not where we were at the very beginning of the session. I'll mention quickly, the S&P is down by 3 full percentage points. Again, not as bad as we were when the bell opened the session. NASDAQ is down by almost 3 1/4%, but still it has suffered stronger losses in this session alone. So still a couple of hours to go, 2 hours exactly before the markets close. We're going to stay on top of that for you throughout this webcast. All right, let's talk about the financial problems and what's happening specifically nationwide. And I know that we had the opportunity to talk with one of our reporters, Thomas Drayton. He is with Fox 29 in Philadelphia. Thomas spoke with a financial expert to really drill down on how the coronavirus is impacting the financial markets.
We're preparing physically, but what about financially? Financial expert Dan Ricardo here to help us navigate. Good to see you, Dan.
Good to be here.
We've seen the numbers go up and down in the markets. What does that mean for us?
Yeah, it means we're still on this little roller coaster, right? We've seen this before. The villains change. Right now it's coronavirus. So the villains tend to change, but the storyline stays the same. We have these events that we can't predict, we can't control, and they impact our financial lives, our investment lives. Or as consumers, we're impacted, but throughout the economy, we'll see these ripples.
In helping to ease some of the concerns, the Fed's cut interest rates?
Yes, so there's some good news here, right? The reality is that if you're a borrower, whether it's a mortgage or a student loan that you're in the market for, you're going to pay less for that loan. So that in turn will ripple through the economy as well. It's sort of a vaccine against the coronavirus.
Seems almost strange when we're talking about a virus like this. What about when it comes to travel? There are concerns.
Yeah, so no question travel's disrupted today. I suspect that'll continue. But again, as a consumer, if I'm looking out on the horizon, I'm thinking, if I'm patient, I might find some better deals later when it comes to booking travel. If you have to book travel now, consider the travel insurance. either the optional type or make sure you have it on your credit card, because you just don't know if that trip is going to be disrupted or not.
And look at some of the cancellation policies.
Absolutely.
You want flexibility. We saw United also scaling back on some of their flights.
Absolutely. So you want to make sure that you have some flexibility. So if you are disrupted, either by mandate or voluntarily, you've got a backup plan.
What about when it comes to goods? I know China's slowing some of the manufacturing right now, some of the goods coming into the country.
Yeah, so the supply chain has been disrupted, and that's one of the great fears, is that as that trickles through the economy, that that's not good for consumers or manufacturers or retailers. So again, we want to keep our eye on that. So far, we haven't seen major disruptions, but I suspect we'll begin to see shortages in some of those more popular products that come from China.
What are we missing here? What's the next domino to fall?
Well, we don't know for sure. Throughout the history of the markets and the economy, we've always had these what we call black swan events. We can't predict them, we can't control them. What we can do is sort of, if we can, vaccinate ourselves from some of the impact. Have that rainy day fund, right? Let's make sure we're not overextended. Let's make sure our portfolios are invested properly. So there's some precautions we can take, even though we can't predict them.
Take a step back, look at the entire picture.
Exactly.
Financial expert Dan Ricardo, good to see you.
Thanks, Thomas.
Send it back to you.
All right, we thank you so much again for joining us. This is part of our daily web live cast that we're doing for you Monday through Friday every day as it directly relates to the coronavirus. We are beginning to join you every day now at 10 a.m. Pacific, 1 o'clock Eastern. And for the next couple of hours, we'll kind of walk you through what is new when it comes to the coronavirus cases being detected, to people being tested, the effect it's having on the financial markets, the entertainment world. And again, we really do have to focus on the direct impact this is having on people. So let's go ahead and swing back to that. With the newest numbers we have to share, we'll pop them up on the screen. You can read them with me. Worldwide, there are now 97,994 confirmed cases of the coronavirus worldwide. Specifically in China, there are just more than 80,000 people there diagnosed with coronavirus. Then we have the United States with 250 cases confirmed. That number is changing minute by minute. In California, we just learned of 3 new cases there confirmed of the coronavirus. So again, these numbers are very fluid, and we are bringing them to you as they continue to change. Let's talk about protecting yourself, protecting your family. One of the largest medical institutions in the country is the Mayo Clinic. And if I can, I'd like to welcome in Dr. Robin Patel, Director of Infectious Diseases Research Laboratory there at the Mayo Clinic. Thank you for being with us. Tell us how the Mayo Clinic is preparing and really now reacting to what's happening with coronavirus.
Right. I think that all hospitals really across the U.S. and across the world are gearing up to deal with patients who may be suspected of being infected or actually infected, handling those patients, and then handling, of course, business as usual in terms of caring for other patients who aren't infected and keeping them safe. So there's a lot of activity going on across hospitals across the United States.
Mayo Clinic is a huge organization, and people come there for various kinds of care every day. Are you telling perhaps your most vulnerable or the more elderly patients to stay away for now, or are the doors completely open?
I think at this point, the doors are open, and this is a situation where we reassess, literally hour by hour, like you are on your show, and thank you for sharing all this knowledge with the public. It's a very fluid situation.
When you make your way around your day, Dr. Patel, what do you see happening in your community that you think, oh no, don't do that, or you think, that's exactly what you should be doing?
Well, I think people really need to understand what's going on. As I mentioned, it can be a little complicated because this is all new. None of us have dealt with this particular virus before.
I hate to interrupt, Dr. Patel, but I do have to. I'm going to put you on a quick pause because I'm getting some information that we're about to go to a live news conference unfolding right now in Philadelphia. So we'll switch to that and listen in as we get the very latest from the city of Philadelphia.
And local partners and receiving and distributing CDC guides. We regularly work with our hospital and healthcare community to prepare for this type of situation, so we're confident that if we get a case, our response will be ready and appropriate. With that, I'd like to turn it over to Managing Director Brian Abernathy.
Thank you, Mayor. I wanted to just take a quick opportunity to say thank you to all of our partners who are here today. Certainly the school district, the Convention and Visitors Bureau, Visit Philly, City Council, and all of our internal operating departments. We have all been working very hard to make sure that the Philadelphia is prepared and feel very confident that we are ready for what this virus may throw at us. I'm going to turn it over now to the experts to walk through, and certainly we'll be back for questions as we go. Dr. Farley?
Thank you all for coming. The first thing I want to say is that the situation is changing very rapidly, and our response is changing rapidly. So I'm going to give you our perspective on what's happening today. That's going to be changing in the future, and so you need to keep up with those changes. As the mayor said, the current situation is that there are no identified cases of coronavirus, COVID-19, in Philadelphia. However, it is our expectation that we will likely have cases at some point. If this infection were to spread widely, there was a risk that more people will become sick, and there's a risk of social disruption from the disease itself and from our response. But if we respond quickly, and if we work cooperatively, and follow through on the basic public health approaches, we can limit the spread and protect Philadelphia's residents. That's what we're here to talk about. Before I get into our response, I want to give you a little bit of background so everyone understands, sort of as a baseline, of the situation we're addressing. If you look at the slide screen here, that's what the virus looks like under a microscope. What is coronavirus? Coronavirus is actually a large family of viruses that we all have experience with. Many different coronaviruses cause a cold that we would tend to get every year. However, there have been two severe coronaviruses that have emerged in the world in the last dozen years, both of which are now contained. One was called severe acute respiratory syndrome, or SARS, that arose in 2003. And there was another one called Middle East respiratory syndrome, or MERS. Both of these had high case fatality rates, but both of these have been contained by public health efforts. The illness caused by the COVID-19 coronavirus is something we now have experience with. There is an incubation period, that is the time between when people are exposed and when they develop symptoms, of between 3 to 6 days, with a range of perhaps 2 to 14 days. The most common symptoms of this infection are a fever and a dry cough, and then that can progress to difficulty breathing. The elderly, smokers, and people with chronic diseases are at greater risk for having more severe illness. So how is this virus spread? Based on our experience with past coronaviruses, we feel it's because when an ill person coughs or sneezes, and that puts out fine droplets into the air around that person, and then that is breathed in by somebody nearby. Or if that person who is ill has secretions, like nasal secretions, that another person nearby comes in contact with, that could also spread the infection. This usually requires close contact. By close, we mean within 6 feet. This provides an opportunity for us to limit the spread of the infection. The people who are most at risk for acquiring infection would be healthcare workers, because they tend to work very closely with people who are sick, of course, and then the family members and close household contacts of people who are sick. People who have much more casual contact, who have much shorter duration exposure or more distant exposure, are going to be at much less risk. So why is it that we are talking about this so much right now? We know that this infection emerged in China in late December, but what's happening now is that it's spread to many more countries around the world. This is data from the World Health Organization of the number of new cases identified per day around the world, and as you can see, it's rising very rapidly, and it's across really all continents at this point. So how are we going to address this problem when it comes to Philadelphia? This is the key elements of the strategy really have to do with containment of the virus. There are 4 steps to that. First is rapid identification of cases. The quicker we can identify cases, the less opportunity they have to spread that infection to others. Second is then isolation of those cases once we have them identified. If they're not near people, they're not going to be spreading infection to others. That's isolation. Then it's identification of people who have already come in contact with people who have this infection and who may have already then been infected by the person who had the illness. And then finally, quarantine. That's a term we use for people who don't have the symptoms of the illness but may develop it. Quarantine of those close contacts for 14 days. When I say quarantine here, for the most part, this is simply, in a sense, self-quarantine. People staying at home under public health supervision so that we are sure that they don't come in contact with additional people if they were to develop this illness themselves. If we can execute on this strategy, then we can contain this virus. And so it's delivery of this that matters the most. Now, there are potentially broader elements to this strategy which are possible in the future but are not needed now. The broader elements are limiting public gatherings so that if someone who was unrecognized got sick, can't expose many people at one time, and other steps to do what we call social distancing, to make it so fewer people are close together so there's less spread from one person to another. Again, thus, we're not recommending that now. We believe that this strategy is the key to it, and that's what we're going to be putting our greatest emphasis on. Now, experience says that if we do this and we deliver on that strategy, that this virus can be contained. Why do I say that? Because of evidence we have around the world. This is the number of new cases by day in China, based upon the reports that come out from the World Health Organization. As you can see, in early February, China peaked at about 4,000 cases per day. They have scaled up the response I just showed you at a very large scale, and through that they've had a huge decline in the number of new cases per day. They're getting now about 100 cases per day. Similarly, the country that has had the greatest number of cases beyond China is South Korea. This is the number of new cases they're having per day. They likewise have scaled up that similar response using those same elements of containment, and it appears to be turning around in Korea now, at least at this point. So we are, and will continue to be working with hospitals and clinics and doctors and health plans and others to execute that strategy. And we're doing that in close coordination with the Centers for Disease Control, who we work with on a routine basis, and the State Health Department. Now, putting this strategy in place is changing day by day. As of today, the testing for the coronavirus is much more available than it was even yesterday. In the past, this testing was only available through the Centers for Disease Control. It's now available at the State Public Health Laboratory, and 2 commercial laboratories have made it available, LabCorp and Quest, which means that any physician in the city can send a test.
Listening in here as we bring you the latest information from city leaders in Philadelphia. You heard him say a minute ago, he popped up some numbers and he said they're changing very rapidly, and so that certainly is the case with even what we're showing you here on our screen. I mentioned just, as we began this live webcast, California had 60 cases and now California has 63. So we also heard the health officials say, kind of going over some of the most important information. Again, Washington State has the most cases nationwide, then comes California, New York, Illinois, and Florida has 4 cases. He said that we're going to be prepared when it comes to Philadelphia. He didn't say if. He is echoing the thoughts of many public health leaders around the country, saying we pretty much expect coronavirus to come to our community. He mentioned that, obviously the signs of coronavirus are what we've been reporting for weeks now: fever, dry cough, difficulty breathing, the fact that it is spread through coughing or sneezing, those droplets that come out that are put onto someone else who is in very close contact with you. He said those people most at risk are healthcare workers, obviously those who are caring for people who are ill, and then also the close family and household members, someone who is living with someone who is ill. Those 2 groups are most likely to become ill themselves. When it comes to who is most affected by the coronavirus, the elderly, people who are smokers, and also people who already have trouble breathing are suffering the harshest effects of the coronavirus. So keep this all in mind. The 2 things that we just heard him highlight is, first of all, quickly identify who is ill with the coronavirus, and then secondly, isolate them so they can't spread their illness to others. So if we can, I'd like to go right back to Dr. Robin Patel, director of the Infectious Disease Research Laboratory at the Mayo Clinic. You focus on diagnostic testing, and we just heard the health officials say it is so important to learn who is sick and then take them out of the general public. But with an incubation period that can be as long as 14 days, and I understand some people are asymptomatic, how do you get an effective test for the coronavirus?
It's a very good question. I want to backtrack on that, if I may, for just a minute, and that is to tell you a little bit about diagnostic testing. In diagnostic testing, we look for evidence of the virus. We look for the RNA of the virus. This is an RNA virus, and we look at respiratory specimens. So, for example, a nasopharyngeal swab, where we put a swab kind of into the back of the nasal cavity, or an oral swab, or if people are coughing up a lot of what's called sputum or phlegm, then we can test that directly. And we're learning a lot about this virus as we go. It's a new virus for us, right? We didn't have diagnostics before this virus emerged at the end of 2019. And so it's been all hands on deck, really, to try to develop and deploy diagnostics for this virus. Traditionally, the way that if you go in and get tested for a virus, that happens is that there's a company that makes a test that sells it to hospitals or clinics that then run that test. Today, we don't have any commercially available FDA cleared tests that can be used in hospitals. And so there is another way that that can happen, and that is that clinical microbiology laboratories that are run by doctoral level certified, board certified laboratory directors can develop their own tests for infectious diseases. And there are many examples of that. Those are called laboratory developed tests. There's a process for doing that that ensures quality testing is out there. But interestingly, there's a regulatory limitation that kicked into place with this particular virus, and that is that when the national public health emergency was declared, there's a regulatory requirement called emergency use authorization, where laboratories can no longer develop their own tests and offer them. They have to first achieve emergency use authorization approval from the FDA. And that process, which is designed to protect the public, really slowed down the development and deployment of laboratory tests at the hospital and clinic level. I'll get back to what tests were offered in a minute. However, I have some good news about that. Last Friday, the American Society for Microbiology, of which I'm the president, sent a letter to the commissioner of the FDA, Stephen Hahn, requesting that the FDA consider adjustments to that policy to allow laboratories to develop their own tests and offer them to patients needing to be tested for SARS-CoV-2, because we really had not a lot of patients being tested at that point. And on Saturday, the FDA issued new guidance that allows that to happen. And so what you're seeing, this is Saturday, 6 days ago. Right. What you're seeing now is laboratories really revving up and offering these tests, and that's what you just heard about from Philadelphia. We have been able to get testing through the Centers for Disease Control and Prevention and other public health laboratories, and there's more of that going on day by day as well. But honestly, that's not enough to serve the needs of what's going on here today. And so what you're going to see as a result of this change in regulation from the FDA, which is very much welcomed, is you're going to see more testing available so that we'll be able to know who actually has this virus and who doesn't have this virus, so that we can put those patients who do have the virus in appropriate situations where they're not spreading it, and try to, as you heard from Philadelphia, contain what's happening.
We also heard Dr. Patel, the official in Philadelphia, talking about SARS or MERS, or of course I remember H1N1. Right. Can you compare or contrast what's happening in your field when it comes to the coronavirus with those previous past health experiences?
Absolutely. So there are some things that are different with this coronavirus compared to those other two coronaviruses, MERS and SARS, that were just mentioned. And in particular, the extent of global spread right now for this coronavirus is much larger, right? And and the numbers, the sheer numbers of people infected. I mean, if you look at MERS, the numbers were about 2.5 thousand. If you look at SARS from 2003, they were just over 8,000. You just showed us the numbers here for SARS-CoV-2, and they're really much larger and still rising for this particular organism. And so there's a lot more need for testing. Obviously, there are a lot more patients that are affected. And there may be more patients affected than we currently recognize because tests are just being rolled out as we speak.
When you hear people in big cities saying, when we get our first case, we are prepared, that could be concerning to some, but is that what you expect to see?
That's absolutely what we expect to see. Working in the area of microbiology and infectious diseases, we have to anticipate what could happen, and we have to be prepared for it. We would really love it if it never happened. And so maybe it sounds negative the way it comes out, but I think it's very important to be prepared. When you look back on a situation, if you're not prepared, that's really not a great situation to be in. If you were prepared and then it didn't happen, well, so be it. You were there and you were prepared. And I think what we're seeing is that there are cases across many states at this point. It's likely that it's going to happen in other places. We just need to be prepared for that possibility. Prepared means think about what you're going to do if and maybe when, if you want to put it that way, it happens. And that I think is very worthwhile to do, so that you don't have to figure out what to do once it does happen. You already know what you're going to do.
All right, Dr. Patel, I'm learning as I listen to you, so we're going to put you on hold. I appreciate all the good information you've given all of us. We'll come back to you here in a minute. I know a lot of people, parents especially, making plans for if my child's school is canceled, I'll have to figure out a way to be home with them. I know a lot of big companies are offering a work-at-home option for their workers, so maybe that's how you're joining us here live right now. However you have found us, I'm glad that you did. You're watching part of our weekday live webcast that focuses on the coronavirus concerns. We are taking the step here to join you every day at this time. We're live streaming every day starting at 1 p.m. Eastern, 10 in the morning Pacific, to get you the latest information on the coronavirus outbreak. We're trying to examine what's happening in the big cities, what's happening in your community, and in a number of different industries as they relate to the coronavirus. We've touched on travel, certainly the financial markets, and let's really make that choice to focus here on what's happening in the United States by putting up again for you some numbers that we've seen change throughout just the time that we've been together today. Washington State still has the most confirmed coronavirus cases of any state in the country. It has 70 cases as of right now. California is now reporting 63 cases. That number increased by 3 in just the past hour or so. New York State is reporting 33 cases there. In Illinois, they're reporting 5 cases. Florida has 4 cases of the coronavirus confirmed. Now let's take a much broader picture and look worldwide. There are now 97,994 cases of the coronavirus confirmed worldwide. China, where the coronavirus originated, is clocking in with 80,710 cases confirmed. Then we have the United States, which has 250 cases confirmed in this country. So let's talk a little bit about not just nationally, but internationally, people who come in very close contact with others. How do they prevent themselves from falling ill? So let's bring in now Faye Manning, infection control preventionist for Volunteers for America. Thank you for being with us. Your workers help those who are most vulnerable. The elderly, disabled, those who are addicted to drugs. You go across the country. How do you make sure that your volunteers are safe while they're doing that good work?
Well, first of all, it's about prevention, making sure our staff are doing good hand washing for a minimum of 20 seconds. We provide our staff with personal protective equipment, training, competencies to ensure they are ready for any type of virus that comes our way, including the coronavirus. We are national, 47 states with over 10,000 employees. With that being said, Volunteers of America can take the leading charge in reducing the coronavirus with our good hand washing by our employees and staff. And residents. We have available at entryways to many of our communities hand sanitizer, making sure visitors don't visit if they're sick. We encourage them to stay home and call to see about their family member or loved one. So, and we do that throughout the year. We encourage visitors that have upper respiratory infections or illnesses to restrict their visiting and call to see how they're doing. So that's some of the ways that we help reduce infection and minimize the risk to our vulnerable population.
Faye, you mentioned preventive measures. Here in the newsroom, we've got one of these on every desk: hand sanitizer, disinfecting wipes. It sounds like it's similar to what you're seeing there where you are in Minneapolis.
Absolutely. Our facilities at the entryway have hand sanitizer. We're lucky. We have great housekeeping departments that clean routinely high-touch surfaces such as your doorknobs, your handrails. We have posters up, cover your cough etiquette displays. We're going to be putting articles in the newsletters. We want to make sure our residents, our families have the facts about the coronavirus and any other virus that comes our way. We are ready.
Faye, I know we've reported on
minimize the risk to
minimize
the
the
vulnerable.
risk, 100%. I know we've reported on a number of big companies that have taken the step to either tell their workers to stay home or have left open the option of working from home. With the volunteers you have in your organization, I imagine if someone's not comfortable, can they refuse an assignment, or how does that work if it comes to that?
Well, refusing an assignment when caring for the vulnerable population, we want to have a chat with that staff member and ask why, and re-educate them on the coronavirus. We will never use punitive measures if a staff member doesn't feel comfortable. But we want to do re-education and work with them as to why they don't want to care for that resident.
So it sounds like you're battling against a lot of misconceptions.
And if they want to, yes. And if an employee is sick, we encourage them to stay home. We don't want to use punitive damages if they have the upper respiratory symptoms or if they're ill. We encourage them to stay home and get rest until they're better, because we don't want them exposing the risk to the residents either, or to other coworkers.
100%. If you're sick, stay home. All right, Faye, thank you for joining us with that good information and a good reminder for us all. A quick welcome or a welcome back to you if you've been with us for the past hour and a half or so. This is part of the Fox television station's daily briefing when it comes to the coronavirus, how it relates to you and your community. And we're looking at the different aspects of health, travel, even entertainment, the financial markets, all of this being affected by the coronavirus. So we've made the decision to join you here live every weekday starting at 10 a.m. Pacific time, 1 o'clock Eastern. And for the next couple of hours after that, we'll dive into all these topics and learn together and bring you new information as we get it, which just happens to be the case when we go to the San Francisco Bay Area. And welcome back reporter Ali Rasmus from KTVU Fox 2 there in the San Francisco Bay Area. You are outside a testing facility and you have new information to bring us.
Yes, I spoke a short time ago with a representative from the California Office of Emergency Services. He says those 45 tests that were done on people on board that Grand Princess cruise ship that's off the coast of San Francisco, those tests are still being processed here at this California Department of Health lab in the town of Richmond. And so they have tested some of those, run some of the tests from some of those patients, but they are still in the process of testing all of those 45 kits. So they are hoping to release some information about the results of those tests later this afternoon. By later this afternoon, he really meant later, like around 4 o'clock. And that he said at that point they might, the State Department of Health and the CDC might issue some sort of notification about the results of those tests. But this all goes back to what's going on with that Grand Princess cruise ship that's off the coast, about 100 miles off the San Francisco coast. It was pretty dramatic yesterday in the way in which they had to get those test kits to people on board the ship. There was a concern that people on board had been exposed to coronavirus, and so they wanted to test to confirm that. And the California Air National Guard had to airlift and drop some of those test kits onto the deck of the ship, administered them to people, and then transported them back by helicopter from that cruise ship over to this lab in Richmond. Now, throughout the morning, we've been waiting for the results of those tests. We were told that they were going to be available this morning. That has not yet happened. And again, latest word from California Department of Emergency Services is that they are hoping to complete those tests. 45 people on board that ship tested, and have those completed results possibly released later this afternoon, maybe though tomorrow. He said he wasn't exactly sure about the timeline and the process for getting all those tests completed. Gasia.
Okay, and so again, this ship is a couple hundred miles off the California coast there. And when you and I talked a few minutes ago, we mentioned how some of the passengers are getting out their daily experience. And just into our newsroom, we got another email from someone aboard the Grand Princess. And Ali, she said basically what everyone's been saying. We're in our room, they're bringing us meals. They've expanded the streaming options because, you know, I can't imagine spending multiple days in a pretty small room waiting for word.
Yes, and what we've heard from the people on board that ship who do have access to social media and the internet, because the cruise ship has augmented its Wi-Fi capacity so that people can communicate with the outside world. But we've heard that they are comfortable. There's a lot of TV and movie options. They have enhanced Wi-Fi, and they're getting their meals delivered to them by a room service. So plated meals, no buffet service. People overall say they're comfortable, but they're of course concerned about the spread of this virus if it is confirmed to in fact be on that ship, the spread of the virus to everyone who is contained and stuck there. And again, as you mentioned, it is about 100 miles off the coast of San Francisco, just stuck in limbo essentially in the middle of the Pacific Ocean until they wait to find out what's going on with that ship and whether there is a case, confirmed cases of COVID-19 on board.
Yeah, because and it's important to stress here, just because someone has, itchy throat and watery eyes and coughing doesn't mean you have the coronavirus. It could be, this time of year, it looks like it's gray and cool where you are there in the Bay Area, but parts of the country are sunny and, flowers are blooming on trees. It could just be seasonal allergies. We have to remember that.
Yes, and also, they mentioned that there were 35 people on board this cruise ship with 3,500 total people. 35 reported having flu-like symptoms, and so that's why they started to begin the process of testing a total of 45 people to get some more confirmed results and more exact results about what's going on there.
Okay, it's good to put those numbers in perspective, Allie, and you've done just that along with bringing us some new information from that testing facility there in the San Francisco Bay Area. Allie Rasmus with KTVU Fox 2. Thank you again. Thank you again for joining us here as we are undertaking this endeavor together to bring you the newest information, as we just heard from Allie Rasmus, when it comes to the coronavirus here in the United States and worldwide. There are a number of tests that we're waiting on the results from the people who are on the cruise ship off the California coast. About a dozen of them or so are being tested for the coronavirus. We don't know yet if anyone has it, so we'll wait to hear more from Allie Rasmus throughout this webcast and certainly through the day. So we're glad that you're with us. We start this webcast weekdays at 10 a.m. Pacific, 1 o'clock Eastern. We go for the next couple of hours, and here we are. So let's, I don't know if you can see this in the picture. You probably can. This is hand sanitizer. We have this on every desk in the newsroom, and that's new in the past couple of weeks. But a lot of people say, and doctors would agree, that actually washing your hands with warm soapy water is best. So let's, if you haven't already, reviewed a little bit about the best hand washing procedures. We get more now from reporter Ty Brennan at Fox 10 in Phoenix.
Well, we've been talking so much about how important it is to have good, clean hands, especially when we're talking about this coronavirus outbreak. So I wanted to get right down to the nitty-gritty. We're on ASU. We're talking to Dr. Haydel here. You're a microbiologist. How important is hand washing?
Absolutely critical. Everything that we touch something else, the microorganisms are there and they can easily spread, whether it be viruses or bacteria. So wash your hands.
So we've done a little experiment. You have put some sort of solution on our hands. What was that solution?
It's lotion that has these little particles that are meant to be similar to germs. But it's basically we put your hand into a big solution of viruses, which really doesn't happen in the real world, but it works here.
So we're going to do this. We're going to have her do it for just a quick rinse and then wash. Rinse with water, no soap here. And we're going to see just if she was able to get off all of that solution off of her hands. So let's take a look. We're going to dim the lights here, and you can still see it's glowing there.
Glowing. Turn it over.
So that shows that.
Whoa.
Oh, and look at all that.
All right, straight up water probably doesn't work so well.
Okay, so now we're going to do it one more time, and then she's going to do it for about 5 seconds with soap and water. Check her hands.
Where we are.
A little better, but not great.
All right, let's turn it over. Whoa, look at there. Look at the rings. Ooh, look at your fingernails.
Ew.
All right, so what was that, 5 seconds?
5 seconds.
Maybe not completely effective.
Not sufficient enough. Okay, now let's do, I'm going to do it for 20 seconds.
20 seconds. All right, let's look for the light.
Oh, not bad.
Not bad. Whoa.
Ooh, but the fingernails.
Fingernails still have some. Let's see a little bit. What's going on under your watch?
Oh.
Okay. Not bad. Oh, look at that wrist. Whoop, whoop. Okay, okay. All right, let's see what you touched before you washed your hands.
Soap dispenser.
Soap. Top of the soap. What about the faucet?
Oh, yeah.
We see some. And we see some.
And then up the mic. Oh, that lights up. Oh, right down there.
Yep.
Lights up.
Everything we touch.
Everything we touch. So this just goes to prove how important that 20 seconds of hand washing is with warm, soapy water. At ASU, Ty Brennan, Fox 10 News.
Okay, that's good to know from the researchers there at Arizona State University. I have two little boys in elementary school, and they got a school-wide assembly on the importance of washing hands. Of course, as parents, we talk about that all the time, but they got down to the nitty-gritty. And if I can bring in Dr. Robin Patel again, the infectious disease research laboratory there at the Mayo Clinic. I have two little boys. One of them is a very thorough hand washer, and then the other one kind of, does it halfway, but I looked and I saw him yesterday and he was washing his hands like this, rubbing his fingernails across his palm to make sure that he got out whatever was in there, that it didn't travel to his mouth, ears, and nose. I was impressed.
Absolutely. Hand washing is really important. I only wish SARS-CoV-2 would glow in the dark like that. That would really help us out a lot, but unfortunately it's completely microscopic and we can't see it, right? You can't see germs. But as was mentioned, you pick them up on your hands, and that's one of the important ways that we get this virus. It's respiratory droplets, yes, so if I'm very close to you and you cough, I might breathe it in, but chances are that whatever you've coughed out is going to land up on surfaces, and then I'm probably going to touch them with my hands. And then if I don't wash or sanitize my hands, then I may touch my mouth or my nose or my eyes, because, we all do that a lot.
Sure.
You want to try not to do that. It's really hard. At least for me, it's really hard not to do that, but try not to do that. But also you want to make sure that your hands are clean, and hand washing is one way to do it. We just saw how to do it properly and maybe not so properly. But hand disinfection, like you have the bottle of alcohol.
Germex? This is not a commercial.
I don't want to advertise for any particular company, but a proper solution for hand disinfection is really good. Hand sanitation, I should say, is really good as well. As long as you don't have particulate matter on your hands where you want to wash your hands first. That is really a very acceptable approach. So it makes sense, not just with SARS-CoV-2 to keep your hands clean, but especially with SARS-CoV-2 circulating, to make sure that you sanitize or wash your hands.
I want to drill down on two things you just said, Dr. Patel. Number one, you said if you're in close contact with someone, when you mean close contact, do you mean if you or I were at the grocery store and we're talking about the oranges they have on sale, is that considered close contact, or do you mean, the kind of conversation, let's say two spouses have at the end of the day while they're putting the kids to bed? How close is close?
Right. Well, let's try to put a little science behind this, right? So first of all, that other person, if you're going to be picking up something from them, has to actually have that infection, right? And secondly, they need to have a significant amount of it in their respiratory tract to be able to transmit it. And I fully expect that different people at different stages of disease have different amounts of virus. That's really hard to know exactly what those levels look like, but it probably does vary. And so if your friend that you're buying oranges with, is perfectly healthy, they may not have a lot of virus, so they may be sort of low risk. We don't know for sure, but I'm extrapolating from some other viral infections. Whereas if they're very sick, coughing a lot, there may be a lot of virus there, and that can really make a difference. So how close, how long? Well, all those things matter, right? So closeness, you heard from Philadelphia, 3 to 6 feet away. That's probably about right. We're talking, you have to be really close, because when they cough, the droplets have to get onto you, or when they're speaking or exhaling, the droplets have to get onto you. So it's not, way across in another room. It's really pretty close. So if you're talking to them, I think that's close enough, unless they're shouting across a room, for example. But it's also the length of time, and that's why you hear about household contacts being important. You hear about healthcare workers, because it's that length of time too. If you're going to talk to that person for 20 seconds versus spend, the whole evening or the whole day or the whole weekend with them, those are two different levels of exposure, and that matters. So it's not black and white, right? But the longer you're with someone who might have this virus, the closer you are to them, the higher the viral load that they may have. Those can make a difference, but also how they're behaving. So if they're coughing, are they covering their mouth in one way or another? and then getting rid of that tissue that they just coughed into, or they
Ideally.
covered their mouth and then picking up the orange. You know, their personal respiratory etiquette will make a difference to you as well. So I think, you know, a lot of this is kind of common sense if you think about it. If you just understand, you know, what's going on from a scientific standpoint, then you can extrapolate where your risk may be.
I feel like we're all on our best behavior, whereas maybe a month ago we were not. So you talked about how you really have to be in close contact with someone to actually have those droplets land on you. What if someone, let's just say, sneezes into their hand, grabs the door handle and walks through? If I come along and grab that same door handle unknowingly, how long does it live, if you will, on a surface instead of person to person?
Yeah, well, we don't have all the answers for this particular virus, but based on what we know about coronaviruses in general, the virus could live for a few hours, maybe a little bit longer on surfaces. And so that's where, again, we come back to hand washing. You know, you're out in public, you're touching things, you should sanitize your hands or wash your hands, especially before you eat, before you would put your hands in your mouth and so forth. So it's possible, I guess, is the answer to your question.
Well, so then I'll go back to mom and dad were always right. And I know that I usually, you know, when I'm leaving, let's say the public restroom at Target or wherever, I'll grab an extra paper towel. I'll use that to, you know, open the door handle to get me out of the restroom. And then I throw that away. And I guess that's something we should be doing as well.
That's fine. I mean, there are a lot of restrooms now that just have open doors where you don't even have to open something to go in and out, right? And then you don't touch anything. I think, yeah, you just want to be aware of what it is that you're touching and what you're doing seems okay.
Do you find, you know, we've had these stories, as I'm sure every television station in the country has, of people going to big box stores, stocking up on, you know, crates of hand sanitizer, crates of those, you know, those Clorox disinfecting wipes, one of which I happen to have right here. Is that hysteria? Is it responsible? Is it somewhere in the middle?
I mean, I think it's good to have them on hand. We just talked about how you would clean surfaces and how you would sanitize your hands, but I don't understand why you need crates of supplies to do that, right? So I think it's a little over the top to do that. But say that you didn't have any, I don't know, soap at home. I don't know why that would be as an infectious disease person, but you didn't. You should probably go out and get some. You don't have to buy, you know, 50 bars of soap, but, you know, have some soap.
Okay, that's good advice. Have some soap. Use it. My little boys taught me 20 seconds, and I'll mention this before we have to let you go, but before I started timing my hand washing, I thought, you know what? I'm going to just do a normal hand washing and see. And I thought to myself, certainly I wash my hands for at least 20 seconds. And I was shocked. I mean, I was under 10 seconds. And I thought that was like a good hand washing. So this has been an education for me and everyone else.
Well, that's actually why the hand sanitizers are helpful, because you just put them on and they continue to act after you put them on, because 20 seconds doesn't sound like a lot. Well, but you probably know, being in media, 20 seconds is actually a long time.
It feels like forever. Yes.
Right. And so it can be a lot easier to simply put the alcohol on and rub it in. Certainly in healthcare facilities, we've transitioned to a lot of hand sanitizer.
Yeah, well, I know my hands are dry from all the hand washing I've done. So Dr. Robin Patel, Director of the Infectious Diseases Research Laboratory at the Mayo Clinic, you've been so helpful and kind. Thank you for joining us and for your time and your expertise.
Bye.
Okay, very good. So I mentioned people buying up crates of hand sanitizer and et cetera. We're certainly seeing it, you know, at the big box stores in our region and likely all around the country. A lot of people, though, may be reacting more out of fear than in relation to the actual fact. So let's talk now a little bit about how you can perhaps help calm those fears and some of the anxiety that may go with news of the coronavirus. We turn again to Fox 5 Atlanta's Beth Galvin.
The coronavirus outbreak seems to be escalating quickly overseas, with new countries announcing infections and health officials quarantining tourists. And with so many unanswered questions, it's pretty normal to feel anxious. It's a mysterious new virus with no vaccine and no approved medication to treat it. So licensed professional therapist Solanda Smith of the Inner Circle Counseling says it's normal to feel a little on edge about COVID-19. And the unknowns can be especially difficult if you're someone who suffers from anxiety. So the next time your mind starts racing with what ifs,
do some really deep breathing from the diaphragm so that you can send more blood to the brain and that you can help dispel those thoughts. You can also get up and walk around. You can jump up and down. You can remind yourself that I don't have it now. It is not in my life right now, and I'm fine.
Since there are a lot of unknowns, Smith says control what you can. Do some research into the virus, then take some steps to protect yourself, like wash your hands often, wipe down shared surfaces, and avoid touching your face. And Smith says children may feel especially worried about this virus, so try associating it with something that they'll understand, like a cold virus.
Remember when you had the measles or you didn't feel good and you had to take time to heal? It's like that. And then say, this is how we're going to protect ourselves. I don't want you to worry about it because we're not dealing with it right now. So don't try to sugarcoat or hide it, but put them on a small alert so that they're mindful when they're around friends and you touch something a friend just needs, go wash your hands.
And Smith also recommends doing what you can to boost your immune system, making sure that you're getting enough sleep. Most of us need about 7 hours a night, trying to eat healthy and get regular exercise. For your Fox Medical team, I'm Beth Galvin.
Good information for us all. All right, we're going to wrap up this live report, but I will mention there are a couple of important things. First of all, the president is in Atlanta. He's visiting the CDC today. We are also now just getting into our newsroom, new information as it relates to the state of Georgia. Georgia has just confirmed 2 new cases of the coronavirus there. So again, the reason we're doing this is to bring you the newest information, and that is what we were just able to do. Let's focus on what is happening nationwide, and we will also look globally as we can look at the latest numbers here that we can share with you worldwide. As of right now, the coronavirus has been confirmed in 97,994 people. China is reporting 80,710 cases. The USA number is actually now at 252 because of those 2 new cases in Georgia I just mentioned. So again, I told you these numbers would change, and here they are doing just that. If we have another set of numbers to share with you, I think we always do tend to focus on where the virus is most widespread. And Washington State still has the most, with 70 cases reported there up in the Pacific Northwest. Next comes California at 63 cases. Remember, that number was 60 when we first began this webcast a couple of hours ago. New York still has 33 confirmed coronavirus cases. Illinois has 5. Florida is next with 4, but again, I cannot stress this enough. These numbers change minute by minute, and that is part of why we are doing this. Every weekday, we come to you streaming live from 1 p.m. Eastern and 10 a.m. Pacific to get you the latest updates we have on the coronavirus. Throughout the past 2 hours or so here, we've talked to doctors about how it's best to protect yourself. We've helped bust some myths as they relate to should people be buying, stacks and cases of paper towels and hand sanitizer. We've also talked about the impact the coronavirus is having on the financial industry, the travel industry, the entertainment industry as well, suffering. So as we leave you with all this, we remind you to come back here and join us on this website when we regain the ability to webcast live to you. So Monday morning, it's a weekday thing, 10 a.m. Pacific, 1 o'clock Eastern. And in the meantime, we do hope that you continue to stay with your local Fox television station for the newest information on the coronavirus. My name is Gasia Mikaelian. I'm so glad that you joined us today, and I'll see you back here on Monday. Have a good weekend.